Hi, I'm Russ Taylor from Johns Hopkins University. When I was asked to write a foreword to this book, I found myself wondering what to say. Upon reflection, I've decided to discuss a few general themes that have emerged over the past 30 or so years that I've been working in this field, and speculate a bit about what a similar collection produced some years from now might look like. Computer-integrated systems are beginning to have an impact on surgical care comparable to that of computer-integrated systems in other sectors of our society. By combining human judgment with the capabilities of robotic and imaging technology and computer information processing, these systems can transcend human limitations to improve the precision, safety, and consistency of surgical interventions while reducing their invasiveness. In addition to enabling better care for each individual patient, these systems enable the use of statistical methods combining information from many interventions to improve treatment processes for future patients. My early work in this field was done at IBM Research, where I led a team that developed a system for robotic hip replacement surgery. And then I led other efforts to develop systems for surgical navigation and minimally invasive surgery before moving to Johns Hopkins in 1995, where my research has continued to focus on all aspects of this three-way partnership of physicians, technology, and information in clinical care over the past years. I talk a bit more about this in the foreword. The chapters of this book provide an excellent sampling of the current state of the art in this rapidly developing field. It's necessarily a sampling. You could easily double or even triple the number of chapters in attempting to provide a truly complete coverage of current work, and given the rapid progress in this field, truly comprehensive coverage will become even harder in the future. However, I believe that some trends are emerging, and it may be useful to speculate about these trends that may be found in some future encyclopedia of computer-integrated surgery. The organ directory, which is one of the nicest features of this book, will expand to cover essentially every part of the body with structures at every scale, all the way down to the cellular level. Technology is going to continue to advance at all scales. Imaging and sensors will become increasingly integrated with surgical tools and with the information infrastructure, and human-machine interfaces will continue to advance in order to provide truly immersive environments for intraoperative decision and shared control of the intervention. I think the biggest changes will be in the use of information at all phases of the treatment cycle. Advances in this area are, of course, highly synergistic with advances in technology and human-machine interfaces. One theme will be real-time information fusion to provide a comprehensive intraoperative model of the complete patient state. Other themes may be found in the emerging discipline of what is now called surgical data science, including the use of statistical modeling and machine learning to relate clinical outcomes to surgical technical outcomes, together with the use of these methods in treatment planning, decision support, and training. Another theme will be increasing levels of what is called autonomy exhibited by surgical robots. In many ways, of course, robotic systems have always exhibited some level of autonomy, and this trend is continuing. In my mind, there are two key issues. First, can you unambiguously tell the machine what the surgeon's intention is for what the robot is to do? And second, can the system get the robot to very reliably and safely execute the surgeon's intention? To conclude, this book really reflects something of a waypoint in the evolution of surgical technology from the use of simple hand tools whose manipulation relied almost exclusively on the surgeon's own senses, memory, and appreciation of the patient state to a three-way partnership involving technology, information, and physicians to treat patients. In exploring it, you may find it interesting and useful to consider how the systems reported in this book already begin to reflect these broader themes and where future systems may build upon them. Enjoy the book.